Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 18 Practice NCLEX questions. Without delay, let's get started.
A laboring client with preeclampsia is prescribed magnesium sulfate 2 grams per hour IV piggyback. The pharmacy sends the IV to the unit, labeled magnesium sulfate 20 grams per 500 milliliters normal saline, to deliver the correct dose. The nurse should set the pump to deliver how many milliliters per hour? Blank ml. The correct answer is 50 milliliters. You set up the formula as 500 milliliters over 20 grams multiply by x over 2 grams. You cross multiply and get 1,000 equals 20x. You divide both sides and you get x equals 50. A 32-year-old multigravida returns to the clinic for a routine prenatal visit at 36 weeks gestation. The assessments during this visit include BP 140 over 90, pulse 80, and +2 edema of the ankles and feet. What further information should the nurse obtain to determine if this client is becoming preeclamptic? 1. Headaches. 2. Blood glucose level. 3. Proteinuria. 4. Edema in lower extremities. The correct answer is 3. The two major defining characteristics of preeclampsia are blood pressure elevation of 140 over 90 or greater and proteinuria. Because the client's blood pressure meets the gestational hypertension criteria, the next nursing responsibility is to determine if she has protein in her urine. If she does not, then she may be having transient hypertension. The edema is within normal limits for someone at this gestational age, particularly because it is in the lower extremities. The preeclamptic client will have significant edema in the face and hands. Headaches are significant in pregnancy-induced hypertension, but may have other etiologies. The client's blood glucose level has no bearing on a preeclampsia diagnosis. The nurse is instructing a preeclamptic client about monitoring the movements of her fetus to determine fetal well-being. Which statement by the client indicates that she needs further instruction about when to call the healthcare provider concerning fetal movement? 1. If the fetus is becoming less active than before. 2. If it takes longer each day for the fetus to move 10 times. 3. If the fetus stops moving for 12 hours. 4. If the fetus moves more often than 3 times an hour. The correct answer is 4. The fetus is considered well if it moves more often than 3 times in 1 hour. Daily fetal movement counting is part of all high-risk assessments and is a non-invasive, inexpensive method of monitoring fetal well-being. The healthcare provider should be notified if there's a gradual slowing over time of fetal activity, if each day it takes longer for the fetus to move a minimum of 10 times, or if the fetus stops moving for 12 hours or longer. A 29-year-old multigravida at 37 weeks gestation is being treated for severe preeclampsia and has magnesium sulfate infusing at 3 grams per hour. To maintain safety for this client, the priority intervention is to 1. Maintain continuous fetal monitoring. 2. Encourage family members to remain at bedside. 3. Assess reflexes, clonus, visual disturbances, and headache. 4. Monitor maternal liver studies every 4 hours. The correct answer is 3. The central nervous system functioning and freedom from injury is a priority in maintaining well-being of the maternal fetal unit. If the mother suffers CNS damage related to hypertension or stroke, oxygenation status is compromised and the well-being of both mother and infant are at risk. Continuous fetal monitoring is an assessment strategy for the infant only and would be of secondary importance to maternal CNS assessment because maternal oxygenation will dictate fetal oxygenation and well-being. In preeclampsia, frequent assessment of maternal reflexes, clonus, visual disturbances, and headache give clear evidence of the condition of the maternal CNS system. Monitoring the liver studies does give an indication of the status of the maternal system, but the less invasive and highly correlated condition of the maternal CNS system in assessing reflexes, maternal headache, visual disturbances, and clonus is the highest priority. Psychosocial care is a priority and can be accomplished in ways other than having the family remain at the bedside. At 32 weeks gestation, a 15-year-old preemie gravida client who is 5 feet 2 inches has gained a total of 20 pounds, with a 1 pound gain in the last 2 weeks. Urinalysis reveals negative glucose and a trace of protein. The nurse should advise the client that which of the following factors increases her risk for preeclampsia? 1. Total weight gain. 2. Short stature. 3. Adolescent age group. 4. Proteinuria. The correct answer is 3. Clients with increased risk for preeclampsia include prima gravida clients younger than 20 years or older than 40 years, clients with 5 or more pregnancies, women of color, women with multi-fetal pregnancies, women with diabetes or heart disease, and women with hydramnios. A total weight gain of 20 pounds at 32 weeks gestation, with a 1 pound weight gain in the last 2 weeks, is within normal limits. Short stature is not associated with the development of preeclampsia. A trace amount of protein in the urine is common during pregnancy. However, protein amounts of 1+ or more may be a symptom of pregnancy-induced hypertension. After instructing a prima gravida client at 38 weeks gestation about how preeclampsia can affect the client and the growing fetus, the nurse realizes that the client needs additional instruction when she says that preeclampsia can lead to which of the following? 1. Hydrocephalic infant. 2. Abruptio placentae. 3. Intrauterine growth restriction. 4. Poor placental perfusion. The correct answer is 1. Congenital anomalies such as hydrocephalus are not associated with preeclampsia. Conditions such as stillbirth, prematurity, abruptio placentae, intrauterine growth restriction, and poor placental perfusion are associated with preeclampsia. Abruptio placentae occurs because of severe vasoconstriction. Intrauterine growth restriction is possible owing to poor placental perfusion. Poor placental perfusion results from increased vasoconstriction. After instructing a multigravida client diagnosed with mild preeclampsia how to keep a record of fetal movement patterns at home, the nurse determines that the teaching has been effective when the client says that she will count the number of times the baby moves during which of the following time spans? 1. 30-minute period 3 times a day. 2. 45-minute period after lunch each day. 3. 1 hour period each day. 4. 12-hour period each week. The correct answer is 3. Numerous methods have been proposed to record the maternal perceptions of fetal movement or kick counts. A commonly used method is the Cardiff count to 10 method. The client begins counting fetal movements at a specified time and notes the time when the 10th movement is felt. If the client does not feel at least 6 movements in a 1 hour period, she should notify the healthcare provider. The fetus typically moves an average of 1 to 2 times every 10 minutes, or 10 to 12 times per hour. A 30 or 45-minute period is not enough time to evaluate fetal movement accurately. The client should monitor fetal movements more frequently than 1 time per week. 1 hour of monitoring each day is adequate. When teaching a multigravida client diagnosed with mild preeclampsia about nutritional needs, which of the following types of diet should the nurse discuss? 1. High residue diet. 2. Low sodium diet. 3. Regular diet. 4. High protein diet. The correct answer is 3. For clients with mild preeclampsia, a regular diet with ample protein and calories is recommended. If the client experiences constipation, she should increase the fiber in her diet, such as by eating raw fruits and vegetables, and increase fluid intake. A high residue diet is not a nutritional need in preeclampsia. Sodium and fluid intake should not be restricted or increased. A high protein diet is unnecessary. A 17-year-old client at 33 weeks gestation diagnosed with mild preeclampsia is treated as an outpatient. The nurse instructs the client to contact a healthcare provider immediately if she experiences which of the following? 1. Blurred vision. 2. Ankle edema. 3. Increased energy levels. 4. Mild backache. The correct answer is 1. Severe headache, visual disturbances, such as blurred vision, and epigastric pain are associated with the development of severe preeclampsia and possibly eclampsia. These danger signs and symptoms must be reported immediately. Severe headache and visual disturbances are related to severe vasoconstriction and a severe increase in blood pressure. Epigastric pain is related to hepatic dysfunction. Ankle edema is common during the third trimester. However, facial edema is associated with increased fluid retention and the progression from mild to severe preeclampsia. Increased energy levels are not associated with the progression of the client's preeclampsia or the development of complications. In fact, some women report an energy spurt before the onset of labor. Mild backache is a common discomfort pregnancy, unrelated to progression of the client's preeclampsia. It also may be associated with bed rest when the mattress is not firm. Some multiparous women have reported a mild backache as a sign of impending labor. A premigravida client at 38 weeks gestation diagnosed with mild preeclampsia calls the clinic nurse to say she has a continuous headache for the past 2 days accompanied by nausea. The client does not want to take aspirin. The nurse should tell the client, 1. Take 2 acetaminophen tablets. They aren't as likely to upset your stomach. 2. I think the doctor should see you today. Can you come to the clinic this morning? 3. You need to lie down and rest. Have you tried placing a cool compress over your head? 4. I'll ask the doctor to call in a prescription for aspirin with codeine. What's your pharmacy's number? The correct answer is 2. A client with preeclampsia and a continuous headache for 2 days should be seen by a healthcare provider immediately. Continuous headache, drowsiness, and mental confusion indicate poor cerebral perfusion and are symptoms of severe preeclampsia. Immediate care is recommended because these symptoms may lead to eclampsia or seizures if left untreated. Advising the client to take 2 acetaminophen tablets would be inappropriate and may lead to further complications if the client is not evaluated and treated. Although the application of cool compresses may ease the pain temporarily, this would delay treatment. Aspirin with codeine may temporarily relieve the client's headache. However, this delays immediate treatment, which is crucial. Additionally, pregnant women are advised not to take aspirin at this time because it may cause clotting problems in the neonate. Codeine generally is not prescribed. When preparing the room for admission of a multigravida client at 36 weeks gestation diagnosed with severe preeclampsia, which of the following should the nurse obtain? 1. Oxytocin infusion solution. 2. Disposable tongue blades. 3. Portable ultrasound machine. 4. Padding for the side rails. The correct answer is 4. The client with severe preeclampsia may develop eclampsia, which is characterized by seizures. The client needs a darkened, quiet room and side rails with thick padding. This helps decrease the potential for injury should a seizure occur. Airways, suction machine, and oxygen also should be available. If the client is to undergo induction of labor, oxytocin infusion solution can be obtained at a later time. Tongue blades are not necessary. However, the emergency cart should be placed nearby in case the client experiences a seizure. The ultrasound machine may be used at a later point to provide information about the fetus. In many hospitals, the client with severe preeclampsia is admitted to the labor area, where she and the fetus can be closely monitored. The safety of the client and her fetus is the priority. The primary healthcare provider prescribes intravenous magnesium sulfate for a premigravida client at 38 weeks gestation diagnosed with severe preeclampsia. Which of the following medications should the nurse have readily available at the client's bedside? 1. Diazepam. 2. Hydralazine. 3. Calcium gluconate. 4. Phenytoin. The correct answer is 3. The client receiving magnesium sulfate intravenously is at risk for possible toxicity. The antidote for magnesium sulfate toxicity is calcium gluconate, which should be readily available at the client's bedside. Diazepam, used to treat anxiety, usually is not given to pregnant women. Hydralazine would be used to treat hypertension, and phenytoin would be used to treat seizures. For the client who is receiving intravenous magnesium sulfate for severe preeclampsia, which the following assessment findings would alert the nurse to suspect hypermagnesemia. 1. Decreased deep tendon reflexes. 2. Cool skin temperature. 3. Rapid pulse rate. 4. Tingling in the toes. The correct answer is 1. Typical signs of hypermagnesemia include decreased deep tendon reflexes, sweating or flushing of the skin, oliguria, decreased respirations, and lethargy progress into coma as the toxicity increases. The nurse should check the client's patellar, biceps, and radial reflexes regularly during magnesium sulfate therapy. Cool skin temperature may result from peripheral vasodilation, but the opposite, flushing and sweating, are usually seen. A rapid pulse rate commonly occurs in hypomagnesemia. Tingling in the toes may suggest hypocalcemia, not hypermagnesemia. A client at 28 weeks gestation presents to the emergency department with a splitting headache. What actions are indicated by the nurse at this time? Select all that apply. 1. Reassure the client that headaches are a normal part of pregnancy. 2. Assess the client for vision changes or epigastric pain. 3. Obtain a non-stress test. 4. Assess the client's reflexes and presence of clonus. 5. Determine if the client has a documented ultrasound for this pregnancy. The correct answers are 2, 3, and 4. Headaches could be a sign of preeclampsia/eclampsia in pregnancy. The client should be assessed for headache, vision changes, epigastric pain, hyperreflexes, and the presence of clonus. Her fetus should be assessed using a non-stress test. An ultrasound done in this pregnancy does not give information to assess the presence of preeclampsia/eclampsia. Which of the following would the nurse identify as a priority to achieve when developing the plan of care for a prima gravida client at 38 weeks gestation who is hospitalized with severe preeclampsia and receiving intravenous magnesium sulfate? 1. Decreased generalized edema within 8 hours. 2. Decreased urinary output during the first 24 hours. 3. Sedation and decreased reflex excitability within 48 hours. 4. Absence of any seizure activity during the first 48 hours. The correct answer is 4. The highest priority for a client with severe preeclampsia is to prevent seizures, thereby minimizing the possibility of adverse effects on the mother and fetus, and then to facilitate safe childbirth. Efforts to decrease edema, reduce blood pressure, increase urine output, limit kidney damage, and maintain sedation are desirable but are not as important as preventing seizures. It would take several days or weeks for the edema to be decreased. Sedation and decreased reflex excitability can occur with the administration of intravenous magnesium sulfate, which peaks in 30 minutes, much sooner than 48 hours. The nurse is administering intravenous magnesium sulfate as prescribed for a client at 34 weeks gestation with severe preeclampsia. Which of the following are desired outcomes of this therapy? Select all that apply. 1. Temperature, 98 degrees Fahrenheit. Pulse, 72. Respiration, 14. 2. Urinary output less than 30 milliliters per hour. 3. Fetal heart rate with late decelerations. 4. BP of less than 140/90. 5. Deep tendon reflexes 2+. 6. Magnesium level equals 5.6 milligrams per deciliter. The correct answers are 1, 5, and 6. The use of magnesium sulfate as an anticonvulsant acts to depress the central nervous system by blocking peripheral neuromuscular transmissions and decreasing the amount of acetylcholine liberated. While being used, the temperature and pulse of clients should remain within normal limits. The respiratory rate needs to be greater than 12 respirations per minute. Rates at 12 respirations per minute or lower are associated with respiratory depression and are seen with magnesium toxicity. Renal compromise is identified with urinary output of less than 30 milliliters per hour. A fetal heart rate that is maintained within the 112 to 160 range is desired without later or variable decelerations. Deep tendon reflexes should not be diminished or exaggerated. The therapeutic magnesium sulfate level 5 to 8 milligrams per deciliter is to be maintained. Soon after admission of a primi-gravida client at 38 weeks gestation with severe preeclampsia, the primary healthcare provider prescribes a continuous intravenous infusion of 5% dextrose in Ringer solution and 4 grams of magnesium sulfate. While the medication is being administered, which of the following assessment findings should the nurse report immediately? 1. Respiratory rate of 11 breaths per minute. 2. Patellar reflex of +2. 3. Blood pressure of 160/88. 4. Urinary output exceeding intake. The correct answer is 1. A respiratory rate of 11 breaths per minute suggests potential respiratory depression, an adverse effect of magnesium sulfate therapy. The medication must be stopped, and the primary healthcare provider should be notified immediately. A patellar reflex of +2 is normal. Absence of patellar reflex suggests magnesium toxicity. A blood pressure reading of 160/88 would be a common finding in a client with severe preeclampsia. Urinary output exceeding intake is not likely in a client receiving intravenous magnesium sulfate. Oliguria is more common. As a nurse enters a room of a newly admitted preemie gravida client diagnosed with severe preeclampsia, the client begins to experience a seizure. Which of the following should the nurse do first? 1. Insert an airway to improve oxygenation. 2. Note the time when the seizure begins and ends. 3. Call for immediate assistance. 4. Turn the client to her left side. The correct answer is 3. If a client begins to have a seizure, the first action by the nurse is to remain with the client and call for immediate assistance. The nurse needs to have some assistance in managing this client. After the seizure, the client needs intensive monitoring. An airway can be inserted, if appropriate, after the seizure ends. Noting the time the seizure begins and ends and turning the client to her left side should be done after assistance is obtained.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.